Welcome to Nursing Prep. Push yourself in nursing preparation with smart way. Practice this quiz on www.thestudyblog.com. Fundamentals of nursing. After 1 week of hospitalization, Mr. Gray develops hypokalemia. Which of the following is the most significant symptom of his disorder? Option A. Lethargy. Option B. Increased pulse rate and blood pressure. Option C. Muscle weakness. Option D. Muscle irritability. Right answer is Option C. Muscle weakness. Presenting symptoms of hypokalemia, a serum potassium level below 3.5 MEq/liter, include muscle weakness, chronic fatigue, and cardiac dysrhythmias. The combined effects of inadequate food intake and prolonged diarrhea can deplete the potassium stores of a patient with GI problems. Which of the following nursing interventions promotes patient safety? Option A. Assess the patient's ability to ambulate and transfer from a bed to a chair. Option B. Demonstrate the signal system to the patient. Option C. Check to see that the patient is wearing his identification band. Option D. All of the above. Right answer is Option D. All of the above. Assisting a patient with ambulation and transfer from a bed to a chair allows the nurse to evaluate the patient's ability to carry out these functions safely. Demonstrating the signal system and providing an opportunity for a return demonstration ensures that the patient knows how to operate the equipment and encourages him to call for assistance when needed. Checking the patient's identification band verifies the patient's identity and prevents identification mistakes in drug administration. Studies have shown that about 40% of patients fall out of bed despite the use of side rails. This has led to which of the following conclusions? Option A. Side rails are ineffective. Option B. Side rails should not be used. Option C. Side rails are a deterrent that prevent a patient from falling out of bed. Option D. Side rails are a reminder to a patient not to get out of bed. Right answer is Option D. Side rails are a reminder to a patient not to get out of bed. Since about 40% of patients fall out of bed despite the use of side rails cannot be said to prevent falls. However, they do serve as a reminder that the patient should not get out of bed. The other answers are incorrect interpretations of the statistical data. Examples of patients suffering from impaired awareness include all of the following except Option A. A semi-conscious or over-fatigued patient. Option B. A disoriented or confused patient. Option C. A patient who cannot care for himself at home. Option D. A patient demonstrating symptoms of drugs or alcohol withdrawal. Right answer is Option C. A patient who cannot care for himself at home. A patient who cannot care for himself at home does not necessarily have impaired awareness. He may simply have some degree of immobility. The most common injury among elderly persons is Option A. Atherosclerotic changes in the blood vessels. Option B. Increased incidence of gallbladder disease. Option C. Urinary tract infection. Option D. Hip fracture. Right answer is Option D. Hip fracture. Hip fracture, the most common injury among elderly persons, usually results from osteoporosis. The other answers are diseases that can occur in the elderly from physiologic changes. The most common psychogenic disorder among elderly persons is Option A. Depression. Option B. Sleep disturbances, such as bizarre dreams. Option C. Inability to concentrate. Option D. Decreased appetite. Right answer is Option A. Depression. Depression typically begins before the onset of old age and usually is caused by psychosocial, genetic, or biochemical factors. Sleep disturbances, Inability to concentrate and decreased appetite are symptoms of depression, the most common psychogenic disorder among elderly persons. Other symptoms include diminished memory, apathy, disinterest in appearance, withdrawal, and irritability. Which of the following vascular system changes results from aging? Option A. Increased peripheral resistance of the blood vessels. Option B. Decreased blood flow. Option C. Increased workload of the left ventricle. Option D. All of the above. Right answer is Option D. All of the above. Aging decreases the elasticity of the blood vessels, which leads to increased peripheral resistance and decreased blood flow. These changes, in turn, increase the workload of the left ventricle. Which of the following is the most common cause of dementia among elderly persons? Option A. Parkinson's disease. Option B. Multiple sclerosis. Option C. Amyotrophic lateral sclerosis, Lou Gehrig's disease. Option D. Alzheimer's disease. Right answer is Option D. Alzheimer's disease. Alzheimer's disease, sometimes known as senile dementia of the Alzheimer's type or primary degenerative dementia, is an insidious, progressive, irreversible, and degenerative disease of the brain whose etiology is still unknown. Parkinson's disease is a neurologic disorder caused by lesions in the extrapyramidal system and manifested by tremors, muscle rigidity, hypokinesia, dysphagia, and dysphonia. The nurse's most important legal responsibility after a patient's death in a hospital is: Option A. Obtaining a consent of an autopsy. Option B. Notifying the coroner or medical examiner. Option C. Labeling the corpse appropriately. Option D. Ensuring that the attending physician issues the death certification. Right answer is Option C. Labeling the corpse appropriately. The nurse is legally responsible for labeling the corpse when death occurs in the hospital. She may be involved in obtaining consent for an autopsy or notifying the coroner or medical examiner of a patient's death. However, she is not legally responsible for performing these functions. The attending physician may need information from the nurse to complete the death certificate, but he is responsible for issuing it. Before rigor mortis occurs, the nurse is responsible for: Option A. Providing a complete bath and dressing change. Option B. Placing one pillow under the body's head and shoulders. Option C. Removing the body's clothing and wrapping the body in a shroud. Option D. Allowing the body to relax normally. Right answer is Option B. Placing one pillow under the body's head and shoulders. The nurse must place a pillow under the deceased person's head and shoulders to prevent blood from settling in the face and discoloring it. She is required to bathe only soiled areas of the body since the mortician will wash the entire body. Before wrapping the body in a shroud, the nurse places a clean gown on the body and closes the eyes and mouth. Thanks for watching. You can also practice this quiz on www.thestudyblog.com, link in description box. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share. Subscribe our channel for regular updates.